Hi everyone and welcome to Ezay Learning. So we are going through ABAT competency standards which is provided by QABA board, and basically you can call it as a syllabus for ABAT exam. You need to cover all these topics for giving your exam. So far in all the parts we have covered the first module, which is autism core knowledge. We have covered legal, ethical and professional considerations. We have also covered core principles of ABA, antecedent interventions, and skill acquisition programming. Now we are at F module, which is behavior reduction interventions. We will be starting with our very first topic of sixth module, which is identify the components and purpose of a behavior intervention plan. So before any further delay, let's get started. A behavior intervention plan is a structured plan designed to address and modify challenging behaviors. And those behaviors are addressed by implementing proactive and reactive strategies. You can say antecedent strategies and consequence strategies. So basically you are using them, you are implementing these strategies to address and modify the challenging behavior. BIP or behavior intervention plan are used in ABA schools and in therapeutic environments. We are going to cover the purpose of BIP. There are mainly five purposes of BIP. First, of course, to reduce challenging behavior. So to help decrease problem behaviors that is interfering with learning, social interaction and daily functioning, and to teach appropriate alternative behavior, to encourage the individuals to use functional and socially acceptable behaviors instead of the challenging ones. This will also help to improve quality of life by enhancing independence, social skills and positive interaction. And along with all this, purpose of BIP is to also promote a consistent approach, ensure that caregivers, educators and therapists apply consistent strategies, and to enhance learning and development, to provide a structured approach to behavior management that supports skill acquisition. These are the main purpose of BIP or behavior intervention plan. Coming towards the components of BIP. First of all, you have to identify the information including individual's name, age, diagnosis if applicable, and relevant background details. So you have to identify the informations first. Then you have to give operational definition of target behavior. So basically a behavior intervention plan will consist of the client's information, then the operational definition of the target behavior or behaviors. You need to provide a clear, measurable and observable definition of the problem behavior being addressed. Now that the operational definition has been provided, the baseline data will be taken. For example, information on the frequency, duration, and intensity of the target behavior before intervention. That's why it is the baseline data. Then you have to identify the function of behavior, that is the reason behind the behavior, using functional behavior assessment FBA data like attention seeking, escape, sensory stimulation, or access to tangible items. Function of behavior. After function of behavior, you have to give replacement behaviors as well. You can specify alternative appropriate behavior that serve the same function as the problem behavior. Antecedent strategies, preventative strategies. These are the methods to modify the environment and reduce triggers. For example, visual supports, structured routines, and choice making. Then there are also consequence strategies, which are also known as reactive strategies. These are the responses to the behavior to increase appropriate behavior and reduce problem behavior. These could include reinforcement, redirection, planned ignoring, and all that. Then BIP plan also includes reinforcement strategies, positive reinforcement techniques to strengthen desired behavior like token system, praise, preferred activities, etc. And then crisis plan if needed. You have to also explain procedures for safely managing dangerous or escalated behaviors. Data collection and monitoring, you have to identify the methods for tracking behavior changes and evaluating the effectiveness of the BIP. Team roles and responsibilities will be also defined. This will include defining who will implement and monitor the plan, for example, a behavior technician, teacher, caregiver, etc. Review and revision the plan, a schedule for assessing the BIP's effectiveness and making necessary modifications. Remember that you, as an ABAT, cannot create or design a BIP behavior intervention plan or any skill acquisition plan. As an ABAT, you are required to implement the plan. The plans must be created by your supervisor, maybe by a QBA. Coming towards the MCQs. What is the primary purpose of a behavior intervention plan BIP? To identify and reduce problem behaviors while teaching appropriate alternatives. Which of the following is not a typical component of BIP? A list of punishments for misbehavior. What is the purpose of antecedent strategies in a BIP? To modify the environment and prevent problem behaviors from occurring. Which of the following is an example of a reinforcement strategy in a BIP? Providing praise and rewards for appropriate behavior. Why is data collection an essential part of a BIP? To track the effectiveness of the intervention and make necessary adjustment. That's all for today. Thank you for watching.